optometrist based here in the UK in the Southwest. I have an independent practice along with my husband Edward, and we specialise in lots of clinical appointments. We manage a lot of dry eye disease. We offer glaucoma services and we specialise in contact lens and also in myopia management and myopia control. We've been in practice for about 10 years. And in that time, we've really developed our skills and our experience along the way in terms of providing really good care for the patients that we deal with, but also offering a very personalised service at the same time. In terms of the management of dry eye disease in my clinic, I tend to consider the JUICE-2 report a really vital resource, because as a practitioner, it gives us a really good guide and clinical and evidence-based guide to understand the typical treatment algorithms that we should be following when we're trying to manage these cases in practice. I find that empowering the patient, educating the patient, and getting the patient on board with their treatment strategies is really an important part of the bigger picture of dry eye disease management in practice. I tend to try to make sure that the patients are on board, so that I will send them videos of their eyes. I'll take image clips from the MYAH and the reporting that we can utilise to send email copies of them to the patients, and that just really allows them to understand more about what's going on. From the point of view of actual management strategies, I adopt various classic practices that I use on a regular basis. So I love my IPL machine, which I use very regularly with many patients. And the nice thing about using that in conjunction with the MYAH is that I can show the patient changes in their tear film dynamics, in their tear film breakup time, very easily and very accurately, visit by visit, so that they can actually see a tangible improvement in things like their tear breakup time by being able to use the MYAH alongside treatment like the IPL. It's really useful to be able to get the patients to come back on a regular basis, and up until recently, before I had access to the MYAH, being able to talk to them about improvement was really based on imaging, slit lamp imaging. So I would be able to talk to them about the subjective measures that I'd taken, so my personal sort of tracking of their tear meniscus height and breakup time. But the issues with that is there is a certain level of subjectivity in gathering that data. So it's really nice to be able to get very accurate objective measure, because it's just much more reliable and much more accurate. And then you can also pick up on smaller improvements with the outcomes for the patient.